Today we're examining blood flow through the heart. And one thing to remember is anytime we have blood flowing to the heart, we're referring to a vein. Anytime we have blood flowing away from the heart, we're talking about an artery. Arteries, almost all the time, have an increased oxygen saturation, whereas veins, almost all the time with one exception, have decreased oxygen saturation. The blood flow starts with our inferior and superior vena cava. Inferior vena cava is called such because it is below, and the superior vena cava is called such because it is above the atrium. Blood flows from the superior vena cava as well as the inferior vena cava into the right atrium. The right atrium fills the right ventricle with blood, and the right ventricle gives a strong push of this deoxygenated blood to the only exception for an artery carrying desaturated or low oxygen containing blood, the pulmonary artery. So the pulmonary artery, remember, anytime we have blood moving away from the heart, we're talking about an artery. But the pulmonary artery has a lower oxygen saturation. Once our blood flows from the pulmonary artery, it moves to the lungs. And in the lungs, it is reoxygenated. So the lungs increase the oxygen saturation of that blood. And then through the pulmonic vein, the only vein in the body containing oxygen-rich blood, the pulmonic vein, we move blood back to the left atrium. So our pulmonic vein is the only vein in the body with a greater oxygen saturation. The left ventricle fills with blood, and that blood moves or is pumped to, or the left atrium fills with blood, I apologize. And that blood is pumped into the left ventricle. Left ventricle, which is the strongest pump of the heart, moves that blood to the aorta. And here we see the ascending aorta, meaning it's going up. And down below, we see our descending aorta, meaning it's going down. What's not depicted here are the coronary arteries that flow off the aorta to feed the heart tissues oxygen and nutrients from the blood that's newly oxygenated as well.